So sealants are like a preventative material that's usually painted on permanent molars. The reason that it's not usually recommended for baby molars is because baby teeth are usually more smooth and less groovy, so the chances of food and bacteria getting stuck in the grooves is pretty low. Although there are some kiddos that have very groovy baby teeth, and sometimes we could recommend it, but most of the time it's the permanent 6-year molars and 12-year molars that are very groovy. So if you imagine if you eat a piece of bread and things are getting stuck in your permanent molars, and over time the chances of getting cavities in those grooves is pretty high. So sealant actually has a very high success rate at preventing cavities on permanent teeth, with long-term studies about 76% less chance of getting cavities if you have sealants on permanent molars. So it's a pretty useful tool, and it's very straightforward and easy to do. The step is very easy and sometimes can be fun for kids. So usually when they come in, we brush their teeth, make sure there's no debris or anything left, and we use what we call the blue shampoo. We kind of shampoo the tooth, make it really clean, and then we have a little conditioner. We paint on the tooth, we shine a blue light, make it really strong, and then we paint the sealant material on. It's kind of like a filling material, but a lot more flowy, so it's very thin. You barely notice it. You flow it into the grooves, and only the grooves on the permanent teeth, and then you shine a light to make the material strong, and that's pretty much it. That's the whole process. The important part is, when you're doing the sealant, it's important to isolate the area to make sure it doesn't get wet, so saliva and things can't contaminate it. That's why we usually wait until the kid can, cooperate for a short period of time, so that if they're done correctly, so we're not cracking off and causing more problems in the future. So if we think a kiddo is ready for sealants, we'll usually talk about it at the recare visit, and once they're on, they could be on for life. I mean, I've had some adult patients in the past that said, I still have my sealants from when I was 6 years old. So they could last forever, they could last 6 months. It really depends on how good you take care of them. Some of the things that could pop sealants off pretty easily is if you eat a lot of sticky things or chew on ice cubes. So if you imagine a lot of crunchy stuff in the back, could eventually wear away the sealants a little bit faster, but we can always repair it, reapply it as needed if caries risk is still pretty high as we age.